anytime you use the word pilot, it always comes with an expiration date. Patients are competing between, do I go for food or do I go for my medicine? You know, arguably, we live in the richest country in the world, and unarguably, many kids and families go home, not well nourished.
This is the Healthy Project Podcast. Conversations with the people working to make health make sense for every community. I'm Corey Dion Lewis. 30 years inside hospitals and health plans taught Dr. Yousuf Ahmad why food as medicine keeps dying in America and what they are trying to build to change it. Let's get into it. All right. Hello, everybody. Welcome back to the Healthy Project Podcast. I'm your host, Corey Dion Lewis. Today, I'm sitting down with Yousuf Ahmad. He's the CEO of AssureCare. His team just launched NutraVance. It's an AI-enabled platform built to help healthcare organizations actually scale food as medicine programs, moving nutrition from a nice idea to something that's built into real clinical workflows. We're going to get into why this took so long, who actually benefits, and where AI should or shouldn't go when it comes to something as personal as food. Yousuf, thank you so much for being here. I really appreciate it.
Thank you, Corey, for having me.
Yeah. So, food is medicine. So before we begin, was there a moment that made you believe nutrition deserved a bigger seat at the table in healthcare?
It's an excellent question. I have been privileged to work in healthcare for now 30 years. And from running hospitals to working for a health plan to working for a physician practice, I always noticed that nutrition and food sat on the sidelines and were never part of central caregiving. So, and even at AssureCare, I've been building technology products now for 10 years. It took its time because it had to be practical for us. And when I say for us, for people giving care. So the timing question is very apt that you're asking. For me, it was, how do we come up with a product that actually helps the caregiver, in this case, dietitians, physicians, nurses, give care in their current workflow for the ultimate benefit of the consumer? And can there be a product that actually takes into account the personalization of the consumer? You know, I grew up in the Mediterranean. I like Mediterranean food. So, can my dietitian prescribe food that caters to my culture, my budget,
Right.
my cadence? And that personalization we were also able to bring in with our product in NutraVance.
Man, you're speaking right to my clinical health coach heart. For about 8 years, I worked for a federally qualified health center, working as a clinical health coach. We did a little bit of food as medicine but it was just grant funded. You had it for a little bit, next it was gone, and now everybody's like, "Oh, this was great. Now where is it at?" Kind of a thing. But when Yusuf, you talked about getting culturally appropriate foods, which is super, super. It sounds like, well, duh, right? Like, yeah, we should be able to do that, but that's not always the case for a lot of people in these spaces. So I totally agree with you there.
Yeah. And then also, just to build upon that, Corey, two people who have diabetes, they were in the past given the same nutrition plan without
Yep.
taking into account their kidney function, their ethnicity, their socioeconomic and affordability. So that is something else that in the past was missing to your question. And I feel like those factors are being brought in now, especially to our product. Because
100%.
every human being is unique.
Absolutely. Um, Yusuf, you spent your career in health tech. What pulled you specifically towards nutrition as the next problem that you wanted to solve?
Um, Great question. I think honestly, it was always there in my subconscious, and But because we, fortunately, or maybe now unfortunately, in America, we are trained in healthcare to manage disease, to treat when something is wrong, and we get reimbursed for treating something that is wrong. And fundamentally, we are not trained to prevent something from happening. Think about your
Hmm.
life, especially as a food health coach from your experience in the FQHC. Only when something gets wrong does the healthcare event get triggered, and then we go see a doctor who then documents based on his or her documentation. We get reimbursed, so on and so forth. So fundamentally, I had to almost unlearn what I had learned. Meaning, let's not think about somebody getting sick first and then coming up with options
Right.
for their treatment, but what can we do that actually helps prevent sickness? And nutrition is a very central force when it comes to what can prevent illness or keep you healthy. And that's where, if you want to call an aha moment, it was always germinating, but it came to its almost like climax when I'm like, we got to do something differently. And what can we do at AssureCare to enable and empower the medical base to use a tool that actually helps them with prevention and not just treatment?
Right on. Right on. And the evidence for food impacts on health isn't it's not new, right? So that goes to my question kind of that I brought up in the intro. Why has it taken this long for nutrition to actually become a part of clinical workflows? Like we know that the evidence is very clear, right? And it's not even that hard. Eat healthier, things like that. But
Yeah.
not everybody has those resources. But why has it taken so long for the industry to go, yeah, food does actually work?
Yeah, and I totally agree with you. Evidence has been there, indisputable, and has been there for a long time. I think the reason it hasn't taken light is because of proof of value.
Mm,
So if you think about how we operate in America, is whatever delivers value, it gets some strong legs on. But because nutrition has not been inculcated in the delivery of care, if I was talking to a health plan CEO, and I challenge anybody today, I personally do, if I'm in front of a health plan CEO, I can convince him or a CFO, him or her, to say, let me show you how proper nutrition reduces hospitalizations, better controls your patient's consumers' A1C, blood pressure, keeps them more engaged as a subscriber. The ROI is 3 to 1. Why would they not do it? So we have not demonstrated proof of value, if you ask me, because nutrition has always been an advice in America as opposed to part of clinical care.
mm. That's yeah. So I'm kind of marinating on that a little bit. Yeah, yeah, you're right. I mean, it's one of those things. It's kind of it's kind of the gift and the curse of healthcare right now. Is like you wanna we know these whole centered holistic ways, and I feel weird saying health or eating healthy is like a holistic approach. It just should just be a different a natural approach. But when you say things like a holistic approach, or these things prevent care, it sometimes doesn't click. And from someone like me, what you just said, like, I find that valuable, but like for some other people, it's kind of hard to get them to that next step of seeing the value if there isn't a actual money in hand when you do it. It feels like.
Exactly. And we use the term whole person care, like you said, but a big part and portion of whole person care is what they ingest or their nourishment. Well, how can that's left out?
Yeah, I know. That's so. Yes, it's a big piece of the puzzle. 100%. You've talked about tools, workflow infrastructure that weren't there. Walk me through what was actually missing.
That's a a deep question, and I like to be specific in that answer because I feel like
Hmm.
there were five things missing, and I believe they are in this order. First thing missing was a proper screening tool. If I cannot screen who is at high risk, then I cannot intervene. What you
Hmm.
cannot measure, you cannot manage. So first thing is screening. Second came workflow. Things were not interoperable with electronic health records. What my dietitian did, my primary care doctor did not know. So that interplay with my medical base had to be there. So workflow integration was number two. Number three is personalization. You know, I want my food prescribed by my dietitian, by my medical team, in the ethnic cuisine that's preferred by my taste buds, and in the budget that my wallet can afford. So that personalization aspect was missing, which AI today is perfectly suited to help, and that's what we are doing. Fourth is measurement. We were not measuring outcomes, so that was missing. And the last and equally important is reimbursement.
Mm.
Pilots would come up and fail because they were grant funded. But if there was proper reimbursement from payers, especially Medicare, Medicaid, and commercial, because they see the benefit, who's the biggest beneficiary if you're able to be healthy and reduce costs? It's somebody who's paying for your care. It could be Uncle Sam, it could be your employer, it could be self pay. Somebody's paying for care.
Right.
So those are the five factors I believe were partially missing or totally missing that are now being more accepted by both the health plans and delivery of care. And I think we've got to just be that much more specific. Uh, you know, are we just having motion or are we actually progressing? There's a difference.
Right. No, 100%. I want to talk about more around the technology and in the AI piece of this because the AI piece in healthcare isn't really new, but as you know, sometimes in healthcare things are a little bit slower to for them to pick up on these, and because of that, I feel like when it comes to AI specifically, some of these tools may not be taking all people into consideration,
Hmm.
right? So like people of color thing and like access. So like when we talk about food access and understanding that like there are under resourced and underserved communities that don't have the same access to healthy foods or same access to healthcare. How do we make sure like a platform like this doesn't end up helping the people who already have the most resources and is kind of limits those who need the resources?
It's an excellent question because it talks about patient centeredness.
Hmm.
Talks about your the fundamental point about your question is how do you address bias that is inherent in the industry today and doesn't advantage the already advantaged population and doesn't disadvantage the already disadvantaged population. So with AI, and even before AI, any products built at AssureCare, they have to be evidence based. You know, what is the evidence saying? On top of that, we layer in social determinants of health. So when I entered healthcare and I was running a hospital system, I would used to ask my team, "Hey, can we ask about somebody's race?" And back in the day, 30 years ago, asking a patient about their race, ethnicity, or language was considered inappropriate. But I
Mm.
have been trained as a public health person that if you know those measures, then you can provide the most personalized care. We have America is replete with examples when English is not your first language and somebody's giving you a treatment plan in English and you're not following it, it's going to be futile. So
Mm.
so evidence based takes into account where okay, it takes away the bias around what sort of care should be given, but it still remains incomplete because it doesn't personalize it. With AI, It allows us to personalize nutrition, not only because I'm healthy, but it also takes into account my current condition. You know, if I have heart failure and if I have diabetes, which is very common in America, if somebody has heart failure, they can have diabetes. Somebody has diabetes, they can have failure. How does that interplay work? And how does the nutrition plan caters to both of my conditions that are equally important to me?
Mm,
And I feel like uh, that time has come. And because
right.
we're not just building another app, NutraVance is not just another app. We have lots of those. It's basically core infrastructure. NutraVance is core infrastructure. It brings this entire set of technology that takes into account evidence-based guidelines, my personal preferences, that includes my wallet size, where would I like to shop. It makes sure that my nutrition plan gets provided real time to my doctor and vice versa, to my pharmacist and vice versa. So my team taking care of me, everybody's on the same page. And it's not that asynchronous, it's synchronous.
Right. It's not like your care is in silos anymore. Everything's into one place.
Yes, because care is fragmented here.
Hmm.
We have physicians working for the same hospital system, employed by the same hospital system, on the same electronic health record, and still not talking to one another, still talking in silos. That
Yeah.
that should become a crime in America.
100%. 100%. Thinking about like the doctors and Nutravance. Walk me through, and you kind of said it already as Nutravance being and I want to make sure, let me say, make sure I'm saying this correctly, but not just another app, but just embedded into the threads of the organization's like everything. Like
Mhm.
it's just another piece to the puzzle. Um, what does that look like for the FQHC or the safety net provider? Not just like the big like hospital systems. Like what does Nutravance look like for a smaller, maybe under resourced clinic like that?
Well, let's take the FQHC example. It's a great example you bring up. So, about 32, 33 million people in America get their daily medical care from an FQHC, a federally qualified health center. I see the workflow being as such: when a patient comes in, say they have multiple sclerosis, which is a high cost disease, and they first get assessed for food insecurity. Hey, Mrs. Smith, first of all, we need to know, can you even afford the nutrition plan that's needed? Because being on a gluten free diet is extremely, extremely critical for an MS patient. And
Mm,
having worked at FQHC's, Corey, that infusion drugs for MS are very, very expensive. So there's already a cost burden on the consumer. We now have to evaluate you for the nutrition burden. Can you afford it? And if you can afford it, do you have access to the right grocer? Because access, as you mentioned in your prefatory remark, is a big issue in America. You know, and and all that has to be provisioned, I believe, and has to be coordinated by the FQ. It's not solely their burden, but nobody really has been the quarterback in taking
mm,
into account affordability and access. Who talks about affordability? You know, every
right.
every
Yeah.
every hospital system and every if I was a president in America, I would say every hospital system, every health plan needs to have a chief affordability officer. If my consumer cannot
100%.
afford the care, I can be the best darn physician and hospital and pharmacist and dietitian. It wouldn't matter. They would never comply because they can't afford it. I mean, we see daily patients are competing between, do I go for food or do I go for my medicine? You know, arguably, we live in the richest country in the world, and unarguably, many kids and families go home, not well nourished.
Yeah.
That's unconscionable.
Yeah, and it goes back, and that leads into my next question and my thought. There's a show that I love. I'm a big sports guy, and there's this commentator, and he says all the time, the answers to all your questions is money. And when we think about reimbursement, that keeps coming up as a barrier. Um, who's actually paying for food as medicine right now, and who should be paying for this program?
So, who is paying? A great two-part question. Who is paying today? They're typically um, negligible. It's usually a grant funded or a pilot by a health plan, and it's really an afterthought. It's not like it's anytime you use the word pilot, it always comes with an expiration date.
Yep.
So that's not good. Who should be paying? Like I said, anybody writing the check for your care should not only be paying, should be the most vested party in this conversation. They should be holding people like us by the lapel and say, what are you doing to bring in nutrition in real time delivery of care? I see a day where today, when a heart failure patient is being discharged in an American hospital, nobody talks about nutrition. So 5 years from now, that should look like a sin if we don't do that. Mrs. Smith, be on a low salt diet. And we should also explain why. What does sodium do to you? If we try
Mm.
hard, a little bit harder, Americans are intelligent consumers. You know, that sort of sermon like physician base, those days are going away. Like I'll give you my life. To my parents, the doctor's word was it.
Yep.
Would never question it. Then came my generation, and we would question it some, but yep, you're still the doctor. More power to you. My children are ruthless. They will ask for five different sources. And trust me, that boat has sailed. So if the medical base doesn't have their act together, then it'll be a tough ride. But I believe payers should be paying for this. I believe Medicaid, every fifth life in America is a Medicaid life. They should be paying for it. There's a big focus on longevity in America, so Medicare should be paying for it. You know, for all longevity studies show that nutrition is just the central force that helps you live longer. Nutrition, exercise, sleep, time and time again.
100%. So, if food is medicine fully succeeds, Yusuf, over the next 10 years, what does that change about how Americans experience the healthcare system?
I think in 10 years from now, just like today, when you go and experience healthcare, they ask you if you have insurance. How would you like to pay? Those are the first questions coming out of people's mouth. Unless you're in emergency care, then they ask for reason for visit and what happened. I see in 10 years they should ask you for your nutrition plan and try to update that first. They should ask, where is the plan?
Mm.
They ask for advanced directives. They ask you
Yeah,
if you're an
that's
organ
fair.
donor. They ask you if you're an organ donor. So that's why it's going to require a mindset shift. So people will ask, do you have a plan? Because if you don't have a plan, let's start there. And it doesn't have to be, only sick people need to have a plan. You know, healthy people can be healthier. We can all do better. So this notion of, because like I said in the beginning, healthcare in America is very sick driven system.
Right.
you know all triggers take place once you fall ill. That sort of redirection in how we look at things needs to change, and I believe it will change. But I think if we show proof of value, how nutrition actually helps you with some meaty outcomes, then healthcare, I've seen in 30 years, catches up to it.
No, love it. Love
Mhm.
it. What Yusuf, what excites you about where AssureCare is right now? Like this is like we said already, food is medicine isn't new, but like honestly, I've been hearing a lot more about food as medicine. Um, what excites you about where you guys have taken your platform and like the capabilities that it has to improve the care of people?
Yeah, that's a question that's near and dear to my heart. It's like you're talking about your favorite child. You know, what excites me about NutraVance, is it sits at the intersection of health, care, and well-being. And you know, there is no technology today that helps a dietitian document care and get reimbursed for it. So NutraVance does that. There's no technology today that is interoperable with your doctor's electronic health record. NutraVance does that. There's no technology today that takes into account your chronic diseases, your entire longitudinal healthcare record, and then personalizes your nutrition around your needs. NutraVance does that. You know, so there's no technology today that does the first three things and then helps you shop better in a grocery store. We have amazing grocery stores in America, amazing retailers, but they're not very smart in helping somebody who has a chronic disease who needs a specific medically tailored meal to shop,
Mm,
who then looks into account, can they afford it? Can also look at their benefits. So that when we look at all these challenges, I see them as opportunities. Are they challenges? Yes. But my mind goes crazy to say these are opportunities for which we should have a solution. And that's how the genesis of NutraVance took place, you know, and that excites me. And then on top of that, we do micro monitoring. Only because you have a nutrition plan prescribed doesn't mean it's going to work. So, okay,
mm,
that's the first step. Let's get to a plan. But then how do you micro monitor? How do you adjust? You know, for the
right.
longest time, I don't know what bok choy meant. It wasn't available in my culture. So then I had to
Right.
study the benefits of it. How do you cook it? You can take it to
Right.
the next level. Maybe next time we have a plan to cook these items. Maybe we partner with somebody. We don't have to build all of this.
Right. So what you're saying about Nutravance is, as your favorite child, is you look at the other child and say, "Hey, why aren't you more like your brother?
Yes,
Why aren't you
yes,
more like
yes.
Nutravance?"
But here's something else. Here's something else. If for some of us like me who are blessed to have more than one child, your youngest child is often the toughest
That's a fact.
because they have kind of dealt with and you have honed your parenting on the first few ones.
Oh yeah.
So Nutrivance is our youngest child, and I'm like a proud parent along with the rest of my associates at AssureCare who have built this product. We have an amazing team. Something else I'll tell you, Corey, it's not a well-known fact that every product we built is clinician led.
Oh wow.
So there is a one of the finest dietitians, in the country named Brian Jones, who's our head of product, who's also a dietitian by pedigree. So
Wow.
every product we make, it has because it's a requirement. It has to be evidence based. And one of the questions you had asked me as a public health official, I'll say, when you study public health in America, it's the only profession where you take an oath for the population. The only one I know. You're a doctor, you're a nurse, amazing, noble professions, but they take an oath for a patient. We take an oath for the entire population and we say we're going to put company profits above the population health needs. So I'm proud of our clinical team that is building these products because their fingerprints are all over it. And they challenge us. They're like, this is not practical. This is not going to
Mm,
scale. Scalability is a big aspect here. And our big thing is at the end of the day, there's a human life, there's a human being that is being cared for on this platform. Let's not forget that. That could be your mother or my mom.
right. No, 100%. And I love that there is that kind of a clinical buy-in. Those people that are looking at it and asking the hard questions to make the platform not only better, but my hope is better for um, all that interact with it from the provider side and the individual being served. I
Yeah,
think that's kind of the most important as well.
yeah. And I'm a bit of a impatience leader here because as I learn about things, and I'll give you an example, I'm like, hey, can we do that? For example, I learned that an overwhelming majority of SNAP eligible beneficiaries who are eligible for supplemental nutrition assistance plan don't get their benefit for the single reason of not being able to fill out the application.
Mm,
And I'm like, wow, why is it that why is that so so then I'm like, go to Brian and my team and say, hey, can we also do that, right? They're like, hey boss, hang on, that's going to come in phase two. But we want
right,
to make sure every step for which you are eligible. I mean, think about it. It should be unconscionable for us in healthcare when somebody is eligible for a benefit, especially around nutrition, and they don't get it because they don't know how to fill out the application. That is nothing to write home to mother about.
right. Well, absolutely. And I'm sure you are in meetings and you're talking to healthcare leaders and professionals all day, every day. And I'm sure there are those people in those rooms that are still kind of skeptical about food as medicine. Um, what do you tell those healthcare leaders who are skeptical that nutrition is worth investing in right now?
And again, a great question, and it has a bit of a stigma for sure, because food as medicine has been not been quantified for those leaders that I work with. I tell them three things. I tell them, first of all, don't think of food as medicine as a silo. Think of food as a very important partner of medicine. Think of quantifying the benefits through nutrition. Something that a lot of health plans are good at. They're good at analytics, but they haven't kind of, like I said, ingested benefits of nutrition. And nutrition
Mhm.
hasn't been taught in medical schools. Like at most, over a 4 year medical degree, maybe 15 to 20 hours are spent on nutrition.
Yeah.
That is nothing. 90% of expense in America of healthcare is towards a chronic disease. 90%. 20% of households in America have food insecurity. That's a big number. So I tell them to give it a chance, remain doubtful, but give it a chance because as you start to see cost curves being bent, as you start to see, member engagement is an all-time low with health plans. 2 to 5% of the entire health plan's membership actually gets engaged. A nutrition product helps you engage the member. So if I'm working on a nutrition plan and you find out as my nurse or doctor that or working for a health plan that I haven't had my physical, you can trigger that gap in care. You know, that's why it needs to sit within the delivery of care, nutrition, and not on the sideline. And we are seeing slowly payers being more embracing of the conversation. You know, we're also trying. Again, we're not a huge company. We're a small company trying to do the right thing. We also want people to take a chance with us because we believe we are bullish that it actually has an impact. It makes a dent on access, on cost, on engagement, on outcomes. You need all four.
Well, I love that, Yusuf. You've been doing this for a very, very long time. So this last question is for me.
I like that. We've never had an interviewer ask themselves the question. I love it.
I've had some really great guests that have done way more than I can even think about to do in my lifetime. It's like, if I have your attention, I'm gonna ask the question. What's a piece of advice about leadership, health, or building something hard that has stuck with you?
Ooh, that is a very thought provoking question.
I mean, we as the
I would
audience need an
say,
answer.
I would say, I'll give you a couple. One is, if you believe in something and you can back it up, go for it, even if the rest of the world is not ready for you.
Mm,
And second thing I would say is there's a difference between activity, motion, and actual progress. And the right leader should be able to differentiate between the two. But I think most of my life, I've been very, very privileged and blessed to have some amazing mentors, great coworkers, great critics who wish you would fail, and you need them also as a motivator. Um, but I think what has served me the best is believe in your conviction, but don't make sure it's in a vacuum. So, I that's been, if you look at my history, you become studious, you study the discipline, the domain, you get experience, you surround yourself with amazing people who will give you unfettered advice, you provide them with psychological safety so they can tell you, Yusuf, this idea is not the best. But once you are all behind an idea, a challenge, then let's go for it. In the execution phase, don't let an outside force kind of, you know, give you tremors and shackle you. Just believe in
mm.
that conviction.
Believe in that conviction. Love it. Thank
Yeah,
you for that. I appreciate that. I know the people listening will appreciate that as well. Yusuf, thank you so much for being on the show with me. Where can people learn more about NutraVance and follow what you guys are building?
absolutely. By the way, thank you for giving me the opportunity. I had a wonderful conversation with you, Corey. They can go to our website, AssureCare.com. You get to know about NutraVance and all our other products. And like I said, please, if you have an opportunity within your respective organization, it could be a hospital system, a health plan, a pharmacy, a grocer, please talk to us and our team, and we'd be happy to help you out.
Awesome. Well, again, thank you so much, and I will make sure I have the appropriate links in the description of this episode on all audio platforms and on YouTube. Again, thank you so much for your time, everybody. Thank you so much for listening to the Healthy Project podcast. I'll highlight you next time.
Thank you.